This is IFV, the web space with your dose of business and financial news. In full view, we're making your business our business.
Welcome to In Full View. I'm Marcella Palmer, bringing you the week's medium and small business news from Rodman and Renshaw in Midtown Manhattan. This investment bank provides a number of services to public and private companies across multiple sectors. It also services institutional investors. We're speaking with Dr. Bob McNally, President and CEO of GeoVax Labs. This small biotech company started its research developing vaccines to prevent and fight HIV infection, operating out of 3 double-wide trailers in the parking lot of Emory University. Today, GeoVax Labs is the leading vaccine candidate for the prevention of HIV.
My background actually started in electrical engineering, and from that I realized that what I wanted to do was apply those engineering principles to biology. And so back in the dark ages, I was one of the first of the biomedical engineers. So this is something that I've always wanted to do, to apply engineering skills to some medical questions, and particularly some hard questions. And HIV and finding a vaccine for HIV is probably the most difficult. You know, some of the perceptions that people have about HIV, especially in this country, is that HIV is a problem for some other part of the world, some developing part of the world, and that it's no longer a big burning issue for those of us in the United States. But when you actually look at the issues and you understand that for the last 2 decades, the incidence of HIV really hasn't changed. It's remain between 55 and 60,000 new cases every year, despite all the millions and billions, really, that are put forward to trying to find a solution to this problem. HIV's been around for 30 years. We had the 30th anniversary last year for HIV, and we're still out there looking for a cure. And so what's different about the design that we have at GeoVax is that the antibodies that are produced after somebody's been vaccinated are very specific for the envelope protein that surrounds the HIV virus. And so what you're doing is you're actually putting these antibodies around the virus and preventing it from being able to infect other cells and tissues. And so you've essentially capped it off. And the other aspect of it is you want to stimulate your white cells to be able to destroy the virus if it's found. And so by stimulating both of those things, the GeoVax vaccine's been very successful. You know, we're considered a leading candidate for the version of the virus which is for the Americas. So we're talking about North and South America and Western Europe. And the reason our vaccine has done so well is because I think the innovation that went into it, and it actually can be used for 2 different aspects. And the first one and foremost is for prevention. I think if we all realize that if it's like a flu vaccine or a polio vaccine, what you're doing is you're vaccinating large groups of the population in advance so that if they ever actually do come in contact with the virus, that their innate immune system will fight off the HIV and it won't develop into any serious medical complications. Now, HIV is so important to the American public and basically to the world. But we talk about our own government. Their objective is to fund research in the Americas, and they play just a pivotal role. We've been the recipient of many millions to GeoVax, not only for research, but all of our clinical trials have been funded. All of our preventative clinical trials have been funded and conducted through NIH funding. And if it weren't for groups like that, I don't think our part of the biotechnology niche would ever survive. And I think thanks go to our government that they see that there are certain diseases that must have some support from government input. Otherwise, we'll never find a cure, we'll never find a treatment, and most of all, never find a way to prevent the spread of HIV. The NIH is actually in writing and in print searching for grant proposals, looking for a cure. And the way the NIH has designed their proposal requests is they want to combine the oral medications that people take when they're HIV positive with a vaccine. And the hope is that if you combine both of those clinical treatments, that indeed you might be able to have a cure. And so GeoVax, in one of our clinical trials that we're going to start hopefully later this year, is going to do just that. In a group of adolescents between 18 and 25, the NIH is sponsoring a program to keep people on their oral medication, give them the GeoVax vaccine, watch those patients over time, and see whether or not in the recesses and the reservoirs where the virus tends to lurk, indeed the viral load may go down, and there's hope that it will go to the point of not being existent anymore. That's a big deal. That's a real big deal.
That's all for this week from the IFV News team. Thanks for joining us from Rodman and Renshaw in Midtown Manhattan. Be sure to check back every day right here at ifvnews.com for the latest on what's happening around the globe in the medium and small business world.